was there.
Nearly 1.25 million people are on TennCare, the state's Medicaid program, but the program is facing 9% budget cuts. Hospitals say they will tax themselves to ease those cuts. Dr. Joey Hensley is a physician and a lawmaker who chairs the committee that oversees TennCare. During a meeting Monday, TennCare's director talked about the Medicaid cuts of hundreds of millions of dollars that this state faces.
Just to give you some idea about the difficulty of the problem that's before us, and that we're not alone.
The lawmaker and doctor will have patients that would be affected by TennCare cuts that cap things like hospital stays at $10,000 yearly or doctor visits to 8.
I'm opposed to this 8-visit limit. I think it's going to be very difficult, number one, to even administer.
Instead, he would like to see co-pays of about $3 to $5, which is not what TennCare Director Darren Gordon has proposed.
It is a tool you have. It's not the best tool you have.
Senator Doug Jackson is another member of the TennCare committee. He favors hospitals taxing themselves to ease the bulk of TennCare cuts so they would be eligible for hundreds of millions of federal Medicaid dollars.
Using provider taxes or provider fees to bring down federal matches. As long as the federal government will let that work, I think it's a good strategy.
Dr. Hensley isn't so sure because the exact details of the temporary hospital tax haven't come yet before lawmakers. Chris Bungard, News 2.
The Tennessee Hospital Association, which has proposed the tax, says it would not be passed on to consumers, but utilized to keep the state from losing hundreds of millions of dollars in Medicaid funding.
Well, today, President